Dr. Sitzman, I have a patient to check out with you if you got the time.
Sure.
Okay. I have Mr. Wasuka. Mr. Wasuka is a 55-year-old gentleman who came in today. He's had 2 weeks of a cough. He says it's been getting worse over the last few days. He's coughing up some greenish sputum. He hasn't had any fevers, no chills, nothing like that. He's been taking oral okay, not vomiting. He hasn't felt nauseous or anything. Not really short of breath. He's had a little bit of a headache in the sinus areas. He says that he is taking some over-the-counter products. He thinks it's a decongestant, but unfortunately not really getting any relief. On review of systems, I mentioned no fevers, chills. He has been taking oral okay, so he's not been changing weight, no night sweats. He is congested, discharged, he's got some sore throat. He's not short of breath. He does have the cough, as I mentioned. He's productive of the sputum. No chest pain, no palpitations, no abdominal pain, no changes in bowel movements, no diarrhea or constipation, no blood per rectum, no vomiting, as I said before. He's urinating okay, no frequency, urgency, hesitancy. He's had a little bit of a headache, no dizziness, no loss of consciousness, no vertigo, no history of easy bleeding either. His past history, he's got hypertension, he has some high cholesterol. A long time ago, he's not even sure how long ago it was, when he was a kid, he had his tonsils removed. Currently, he is on lisinopril 10 milligrams daily. He's on Lipitor 20 milligrams daily. He's allergic to Zithromax. He gets a rash. Unfortunately, he is a smoker of about a pack a day, and he's done so for 20 years. Drinks alcohol a little bit, no other reported drug use. On his physical exam, he's got a temperature of 99.0. Blood pressure is slightly elevated at 145 over 90. Heart rate is 90, respiration is 14. He is satting fine with 97% on room air. Overall, he's alert and oriented. He's in no acute distress. He is he's definitely a little congested on examination of his nose. He's got some swelling of his turbinates. He does have some greenish discharge on both sides. He is tender over the maxillary sinuses, a little bit more on the left than on the right. He's slightly erythematous on the pharynx. He definitely has some of that green discharge going down the throat. Neck, he's got a little bit of shoddy lymphadenopathy, but nothing really major. Regular rate and rhythm with no murmurs on heart exam. Lungs are clear. No respiratory distress. He's soft, non-tender, non-distended, good bowel sounds, no rebound or guarding in his abdomen, no edema or cyanosis on extremities, and neurologically he is intact. So my impression is he has acute maxillary sinusitis. My plan is to treat him with amoxicillin 875 milligrams by mouth twice a day for 10 days. I would like him to call if he gets any worse, or if things are certainly not getting any better within the next week or so.
Okay. And how long did you say this has been going on?
This has been going on for about 2 weeks.
Okay. So I agree with antibiotics. It's been over 10 days, and that's kind of one of the marks we want to look for. He does have the tenderness and the productive phlegm and everything. You did mention his blood pressure was a little high.
Yes, I did.
I didn't hear that in your plan. What do you think of that?
That is correct. He has a blood pressure today of 145 over 90. He does have a history of hypertension, for which he takes the lisinopril.
And how old is he?
This gentleman is 55 years old.
Okay, so what would our goal be for him as far as blood pressure?
For this gentleman, I'd love to get him down around 120 over 80. I would accept 130 over 85 in a gentleman of this age.
Sure. So really, he doesn't have the diabetes or any of those other things that are going to make us really want to hammer down on the blood pressure, but yeah, it is a little bit elevated. The diastolic 90 is definitely something we want to address.
Mhm.
So we could go up on his blood pressure medicine, but one of the things you told me he's been doing is taking decongestant. What do we know that can do?
That is true. That can certainly increase the blood pressure.
So do you want to watch it for now? Do you want to, how soon are we going to see him back?
Well, I guess I would be a little hesitant to change his medication today, given the fact that the last few times he's been in, his blood pressure has been well controlled.
Okay.
Mr. Wasuka is a pretty dependable patient in my experience. I think I probably could get him to check his blood pressure at home. I know he does have a home monitor. I don't know how often he does check it, but I believe I could get him to recheck his blood pressure at home after this has subsided, and I bet there's a good chance it's going to come down without changing the medication.
I'm okay with that. Young Dr. Berger, I think you've done a really good job presenting. There's one more thing that as we go in to see the patient, I think that we should address together with him. And that is when you have somebody who's a smoker who comes in with respiratory complaints or sinus complaints, studies show that's the best time to talk about smoking cessation with them. So let's try that, okay?
Absolutely. I think I will probably identify that as a medical problem as well, and probably just list that in his problem list too, so that we can make sure. Absolutely.
I think that's a great idea. Okay, well let's head out. What room is he in?
Thanks. He is in room 5.
Okay.